Hello guys, another video. We're gonna today talk about the acute cholecystitis. Acute cholecystitis is an inflammation of the gallbladder. It's potentially a serious condition that usually needs to be treated in hospital. The main symptom of acute cholecystitis is a sudden sharp pain in the upper right side of the abdomen that spreads toward the right shoulder. The affected part of the abdomen is usually extremely tender, and breathing deeply can make the pain worse. Unlike some other types of abdominal pain, the pain associated with acute cholecystitis is usually persistent and doesn't go away within a few hours. In some people, may additional symptoms occur like high temperature, nausea, vomiting, sweating, jaundice, and block in the abdomen. The cause of acute cholecystitis can be grouped into two main categories. It can be calculous cholecystitis, which is the most common and usually less serious type of acute cholecystitis. It develops when the main opening to the gallbladder, called the cystic duct, gets blocked by gallstone or by substance known as biliary sludge. Biliary sludge, which is a mixture of bile and small crystals of cholesterol and salts. The blockage in the cystic duct results in a buildup of bile in the gallbladder, increasing the pressure inside and causing it to become inflamed. The inflamed gallbladder also becomes infected by the bacteria. Another type of acute cholecystitis, we have a calculous cholecystitis. A calculous cholecystitis is less common but usually more serious. It usually develops as a complication of serious illness, infection, injury that damage the gallbladder. It's often associated with problems such as accidental damage to the gallbladder during minor surgery, serious injuries, burn, blood poisoning, or AIDS. Acute cholecystitis is a relatively common complication of the gallstone. To diagnose acute cholecystitis, the doctor will examine the abdomen. The doctor will probably carry out a simple test called Murphy's sign. The patient will be asked to breathe in deeply with the doctor's hand pressed on the tummy, just below the rib cage. The gallbladder will move downward as the patient breathes in, and if patient have cholecystitis, he will experience sudden pain as patient's gallbladder reaches the doctor's hand. If the symptoms suggested that the patient has acute cholecystitis, the doctor will refer the patient directly to the hospital for more tests and treatment. Maybe the doctor will ask for blood tests to check the sign of inflammation in the body. Also, an ultrasound scan of the abdomen to check for the gallstones or other signs of a problem that the gallbladder has. Other scans like X-ray, CT scan, or MRI scan may also be carried out to be examined to the gallbladder in order to get more details if there is any uncertainty about the diagnosis. If the patient diagnosed with acute cholecystitis, he will probably need to be admitted in the hospital. For treatment, you have initial treatment, which will usually involve fasting, like not eating, not drinking, to take the strain of the gallbladder, receiving fluid through drip directly into the vein intravenously to prevent dehydration, and taking medications to relieve the pain. If the patient have suspected infection, he will be given antibiotics. This often needs to be continued for about a week, during which time the patient may need to stay in hospital or the patient may able to go home. With this initial treatment, any gallstone that may have caused the condition usually fall back into the gallbladder and the inflammation often settles down. Another treatment, you have surgery. In order to prevent acute cholecystitis recurring and reduce risk of developing potentially serious complication, the removal of the gallbladder will often be recommended at some points after the initial treatment. The name of surgery is cholecystectomy. Surgery can be carried out into two main ways. First, laparoscopic cholecystectomy, a type of keyhole surgery where the gallbladder is removed using special surgical instruments inserted through a number of small cuts in the abdomen, or open cholecystectomy, where the gallbladder is removed through a single larger incision in the abdomen. Although some people who have had their gallbladder removed have reported symptoms of bloating and diarrhea after eating certain foods, the patient can lead a perfectly normal life without the gallbladder. The organ can be useful but not essential, as your liver will still produce bile to digest the food. Possible complication: without appropriate treatment, acute cholecystitis can sometimes lead to potential life-threatening complications. The main complications of acute cholecystitis are death of the tissues of the gallbladder, called gangrenous cholecystitis, which can cause a serious infection that could spread throughout by the body. Another complication, the gallbladder splitting open, known as perforated gallbladder, which can spread the infection within the abdomen, like peritonitis, or lead to buildup with abscess. It's not always possible to prevent acute cholecystitis, but the patient can reduce the risk of developing the condition by cutting the risk of gallstones. Being overweight, particularly being obese, also increase the risk of developing gallstones. You should therefore control the weight by eating healthy diet and exercising regularly. A diet with low fats, low proteins, high of fibers. However, low calories rapid weight loss diets should be avoided because there is evidence they can disrupt the biochemistry and greatly increase the risk of developing gallstones. A more gradual weight loss plan is the best. So it's not important like just to have a diet without with less protein, less fats. The important thing is planning for the diet with a professional coach or professional nutrition professor, and that's all. Today why I talk about cholecystitis because it's close for the gallstones, and the previous video was about the gallstones. So I want to make a series of biliary system diseases and the treatment, and to finish first, and this is bye.